All right. Hello, everyone, and welcome to another episode of Pod Isa. Today, I have the honor of hosting a very special guest and a colleague, a very special colleague, Dr. Anthony Staines. He said to call him just Anthony, but I want to call him Dr. Anthony Staines because he's a very distinguished global leader in patient safety and healthcare transformation in public health. Dr. Anthony has a remarkable career dedicated to improve healthcare systems worldwide. He is currently the Patient Safety Program Director at the Federation of Vault Hospitals in Switzerland and has an extensive background in hospital management, patient safety strategies, and health system improvement. He has been active collaborating with the WHO and international healthcare organizations, shaping policies and initiatives to enhance global patient safety. Dr. Anthony, it's a pleasure to have you here today and welcome to Pod ISA. The floor is yours. Please briefly introduce yourself.
Thank you very much for having me. I'm passionate about quality and safety in healthcare. I started my career as a hospital CEO, and I've been a hospital CEO for about 10 years in Switzerland. And I had lots of discussions with physicians about quality of care, safety of care. And then when, after 10 years, I had the opportunity, I went back to studies and did a PhD, and my dissertation was on quality improvement programs in hospitals. And so since then, it's about 15 years, I've been full-time on quality and safety. So I'm very happy to be with you today.
Well, thank you so much. Um, to start, I know that you began as a CEO of a hospital and followed by your PhD program. Um, but could you share with us a little bit about your professional journey and if you have a turning point, something that called your attention, why patient safety with so many subjects? Why did you choose patient safety to draw your career?
One thing, Isabella, that I remember very vividly when I was a hospital CEO is we had the death of a patient, and that was because of Legionella disease. And we investigated what had happened. It was the first time it ever happened to us. It wasn't really well known in Switzerland. And I realized that we had been lowering the temperature of the water heaters to make economies, to lower the budget after following recommendations from the Swiss state. And I realized that probably there was a link between lowering the water heater and that Legionella disease for that patient. And I was devastated. And that was the first time an event really made me think about patient safety. And I felt that we had failed this patient. And I sort of felt personally responsible as the CEO of the house that had hosted that patient. And so that was really a turning point for me. And I got more and more interested in quality improvement and patient safety. And I started to realize the magnitude of the problem. And I think not many people really realize the magnitude of the patient safety problem, the burden of harm that we have around the globe. And so that was how I went into patient safety.
Oh, brilliant. Thank you so much for sharing. Not everybody has the courage that you just had to share with so bravely with this honest. Thank you so much for sharing this with us. So now let's shift a little bit to something that the world has an eye on. It's the Swiss model of patient safety. Switzerland is often regarded as a benchmark in healthcare quality and patient safety. So What do you believe are the key aspects that make the Swiss model so unique?
Well, first of all, I don't think Switzerland is so unique, and I don't think Switzerland is leading in quality and safety of care. There is a little bit of confusion because Switzerland has rather good health indicators. By that, I mean indicators such as life expectancy is rather high in Switzerland, amongst the best in the world. Infant mortality is very low. And a lot of people believe, oh, that must be because they have good health care. But as you know, Isabella, there are social determinants of health, and I think that's our strong point. We have rather high revenue in Switzerland. Education level is rather high. Most of the people have decent homes, etc. And so all of these social determinants of health bring good state of health. But I don't think that healthcare is particularly good. If you take international studies, for example, on patient safety, you may see that Switzerland leads on one or two studies, but is weaker than the other neighboring countries on some other studies. And on average, Switzerland is sometimes a bit better, sometimes a bit worse, but it's rather comparable to neighboring countries. The only thing that is higher in Switzerland is not quality, it's costs. Switzerland costs more than other neighboring countries. So for the money the citizens pay, they should get better healthcare and better patient safety, I believe. So, uh, I mean, one of the characteristics of Switzerland is that it has a rather decentralized healthcare system. And that's an advantage for some issues to be closer to the needs of the population, the local needs, etc. But it provides a fragmented healthcare system that is sometimes difficult to navigate for patients. You know, we're a very small country. We have less than 10,000 inhabitants, which might be a large city in Brazil. And we have 26 cantons, and the healthcare is managed by the 26 cantons. So we have 26 ministers of health in Switzerland. So, yes, it's a bit fragmented.
Yeah. I think you are being modest, but I kind of agree with you. You have some challenge. Even being the Swiss model, you still have some challenge, and people might make some confusion with the quality of life and patient safety. We are kind of different stuff. I agree.
Yes, and Switzerland has also rather weak regulation. Like many countries have a national accreditation program. Switzerland has two or three rather small voluntary accreditation programs, and the uptake is rather low. So the majority of hospitals are not accredited, and so it doesn't provide the momentum that we could get through a more nationalized healthcare system.
Yeah, I completely agree. Um, you know that I've been we met actually at WHO. I had the pleasure to connect with you at WHO, where I've been advocating for patient-centered care. This is one subject that I have a very I have my heart on it for personal and professional reason. And I would like to discuss with you a little bit the role of patient-centered care in healthcare transformation. You know that patient centered care has been increasingly discussed as a fundamental pillar of high quality healthcare. So, how do you see its role, the role of patient centered care, in improving patient safety and healthcare outcomes in your point of view, in your own perspective?
Well, I really believe that it's impossible to get good quality of care and good safe care without partnering with patients. I think too often uh, the the healthcare professionals believe that they know what is best for their patient without asking their patient. So I'm relaying the campaign that is called What Matters to You, that was launched by Maureen Bisignano. And I think it's such an important question. Take, for instance, shared decision making. I believe what should happen is that the physician or the healthcare professionals should inform the patient about the possible options, the treatment options, the benefits, the risks, etc., and then should ask the patient what is important to you, to you, what matters to you, and through the what matters to you question, explore the preferences, the values, the reality of the life of the patient. The patient is, after all, an expert in terms of living with the disease. The professional is an expert of the disease, but the patient is an expert of living with the disease. And so we should much better understand the needs, the values, etc., of patients, and then it should lead to a true shared decision-making process. And the final decision should be that of the patient, not of the healthcare professional. So, for example, in shared decision-making, I think it's so important. But also in the patient engagement for patient safety is very important. You know, at the Hospital Federation of Vaud, we run breakthrough collaboratives. We use the IHI model of breakthrough collaboratives, and my role is to lead these collaboratives, or to co-lead these collaboratives. And we had that collaborative on reducing adverse drug events. And of course, we noticed, well, if the patient understands his or her medication, then the patient can be aware and can ask questions and say to the nurse, for instance, I got every morning a blue pill and today it's red. Why is there a difference? And the nurse might say, oh, sorry, it was for someone else, etc. And so the more the patient understands, gets involved, is engaged, etc., the more the patient can contribute to his or her own safety. So we noticed that for medication safety. Then we had a collaborative on reducing pressure ulcers. And of course, if the patient understands the phenomenon of pressure ulcers, the patient can redistribute his weight in the bed, for instance, or in the chair, etc. And that is a major contribution to not acquiring a pressure ulcer during care. So I think in just about almost all of the topics that we've handled on patient safety, we noticed that the contribution from the patient can be absolutely major and can really make the difference. And so what we're doing at the moment is launching a new collaborative that is on patient partnership. So we're promoting shared decision-making, patients in governance, teach back, etc., all the tools of patient partnership.
Lovely, lovely to hear. Well, congratulations on this, and on behalf of all the patients, thank you so much for that. That's what we need. Include the patients. That's what we need for better outcomes. Is put the patients together to partner with the patients.
And
And
it's
by
quite
the way,
exciting. It's quite
sorry.
exciting because I'm learning a lot through the contact with patients. So
Oh, beautiful.
asking these questions, what matters to you, is really so important, and is such a lot of learning. When I try to convince healthcare professionals about what matters to you, I tell the professionals, think of 3 of your patients. Now think what you think matters to them. Now go and ask them and study the difference between what you thought was important for them and what they say matters to them. And you'll see it's a lot of learning.
Well, I just love this campaign. I'm involved with them since 2016. I've been to Scotland to shadow them. So I'm suspect to say, but like you, I love this. I just love this. And I've been trying to involve this conversation also in dental care, because it's a part of the primary care that there is a lot of room for improvement in terms of patient safety and patient experience, and where patient usually also don't have a voice either. Oh wow! By the way, Speaking of patient participation and what matters to you movement, WHO campaign this year is again about maternal health, which brings the patient participation again to the table. And we've had one meeting already about the campaign. And I would like to explore with you a little bit your collaboration with WHO and the global patient safety. Your work with WHO. You have a strong connection with WHO and its global patient safety initiative. Could you share a little bit more about your collaboration with the organization?
With pleasure. Well, first of all, I think WHO's role is vital for patient safety because we need international collaboration. We need not to reinvent the wheel everywhere. We also need a body, an international body, to raise international awareness. And I think WHO has managed very well with its patient safety action plan. They managed to catch the attention of leaders, of people in governance positions, etc. And we really need that because we still have a lack of awareness and understanding about patient safety issues. So I think that's vital. I've been involved in translating some of the patient safety programs from WHO into French and in promoting WHO programs such as the surgical checklist or the international classification for patient safety or the patient safety action plan, etc. So that's one of the involvements. I've been involved in the patient safety consultation of experts. I'm one of the patient safety experts registered with WHO, and that's a fantastic opportunity to meet like 200 people from around the world, the diversity of culture, of stages of implementing patient safety, etc. And I had a special connection with WHO because I was asked by the Swiss government to coordinate the Global Ministerial Summit on Patient Safety that was held in Switzerland in 2023. So it is in Montreux, which is rather close to where I live. It's about 50 kilometers from where I live. And I was co-designing the scientific program of the ministerial summit with another academic called Didier Pittet, who's been the lead for hand hygiene for WHO, and that was a very special memory for me. So these are the connections with WHO.
Oh, lovely, lovely. They are lucky to have you. They are lucky to have you. I think I'm lucky to have met you too. Thank you so much for sharing. So, at this point of your career, Dr. Anthony, and being from Switzerland and having being in contact with the some healthcare systems globally, could you imagine what lessons from Switzerland do you believe you that could be applied to other countries to improve patient safety in other countries?
Yes, well, I can think of a few things. The first thing I'd like to say is I believe we have more to learn from other countries than to teach to other countries, but still,
Will be very modern.
there are a few lessons. The method of the breakthrough collaboratives that I've been involved with brings good feedback. We have a very good experience with that. The key idea is to bring together a few different institutions who work on the same topic, like reducing adverse events on medication, for instance, the example that I've just been giving. And so you create an environment where there is a balance between cooperation and competition. There's a bit of competition because you benchmark the results of all of the hospitals that work in the collaborative, but they all learn together. All of them teach and all of them learn. And so it creates a very special environment that is very beneficial to patient safety and to quality of care. So that's something that I would recommend. For me, it's a lesson from our system, the use of breakthrough collaboratives. I believe Switzerland has been a pioneer also in crew resource management. It's University of Basel in Switzerland who pioneered crew resource management. So the idea was to steal some key principles from airlines, where everything is preset to uh, to tap into the skills of all the interprofessional team or even the passengers in the plane to manage safety together to the best possible level. And so some Swiss scholars uh, tested this in healthcare, and I believe it has led to methods such as team steps, and there are others. But the global principle of crew resource management, I believe, was pioneered in Switzerland, and I think is a good idea. Um, One thing that we've piloted as well, and I think that works well, are training sessions for board members of healthcare institutions, like boards of hospitals. I mean, board of trustees, the people that supervise the C-suite, the management of the hospital, and raising awareness on patient safety at that level, making sure that these people who decide on the budgets, decide on the strategy, etc., understand patient safety. That is something that can really change the level of safety in an institution. So it's something that we've started to do. We haven't done enough for the moment, but I think is important. And the last lesson that I would mention is investing in social determinants of health, being modest, being humble in terms of healthcare, and remembering that healthcare contributes to health to about 10 to 20%, and that the other 80 to 90% come from social determinants of health. And I believe in Switzerland we are not too bad in social determinants of health, although in healthcare itself, I think we still need quite a bit of improvement.
Bravo, bravo. This should we should write a manifesto on this. Bravo. Thank you so much for sharing. Well, we have covered how you started your career, a little bit of your past, your work in the present, your intersection with WHO. Let's talk a little bit about the future of patient safety and some closing thoughts. When you look ahead, looking toward to the future, what major transformations do you foresee in patient safety, both in Switzerland and globally?
So you've saved the easy question for last, have you?
Oh, wow, the $1 billion question.
Couple of ideas. First of all, I think we need to question our definition of harm. Patient safety is the lack of is harm to patients, but how do we define harm to patients? Take the example of a patient that has had a near miss, and the patient could have died in this adverse event, but it was a near miss, so it did not hurt the patient, but the patient can be still very traumatized by thinking about what could have happened to him or her. And so it's sort of psychological harm, and I think we need to include psychological harm in the definition of harm to patients.
Super great perspective.
So I think we need to broaden, to widen the definition of harm. Another thing that is nothing new, but that is still, I think, very that demands our attention, is leading culture change. I see in Switzerland lots of people believe, like for instance, when we train board members in Switzerland, we do an online survey before the training, and we ask them, what part of the patients of your hospital do you think get harmed by healthcare? Is it 1 in 1 million, 1 in 100,000, 1 in 10,000, etc.? And still quite a number of people believe it's 1 in 100,000 or 1 in a million or 1 in 10,000, when the actual true response to that is 1 in 10, or perhaps even more than 1 in 10. How many people know that we have, on average, in the developed world, one medication error per patient and per day, one per patient and per day? These are orders of magnitudes, etc., that should be better known. And so this would transform the culture. And so I think raising awareness, leading cultural change is still heavily needed. Another topic is investing in staff safety. I think we cannot just say we want patient safety if we don't provide staff safety. I think the era of COVID has really made the demonstration that there is no patient safety without staff safety, without healthcare worker safety. And so, and when I say safety, it includes the well-being and the psychological safety to dare say something if something goes wrong. And tell the patient that something went wrong, and tell the leaders of the healthcare institution that something went wrong. There's of course the topic of patient engagement and patient involvement, and there I think we've done no more than the trader. We really should have to take a leap forward in partnering with patients and listening much more to patients, listening to their values, to their expertise, to their preferences, etc. Interprofessional work also needs to take a leap forward. We are still in healthcare professions where there are some profession leading other professions, and we should have every profession that should have its expertise to bring to the table. And so we should really listen to the interprofessional teams. And also in risk management, we should make sure we don't see the risk at just one step of healthcare, but we should see the risks over a whole patient pathway. The patient comes to the emergency room, then goes to the surgical unit, then to the OR, then perhaps to the intensive care, then back at home with home care, etc. What are the risks at the interfaces, etc.? So these are a few issues where I think we really have still major steps to take, and I believe it will happen. It happens little by little, much too slow for my taste, but it does tend to happen.
Yeah, yeah. Great, 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 great points. Thank you so much for sharing. Dr. Anthony, this conversation has been incredibly insightful. Unfortunately, we are coming to a close, but before we close, I would love for you to leave. You just shared some incredible thoughts, but I would love for you to leave a final message for our audience. But just one, if there is one key takeaway about patient safety that you want this audience to remember, what would it be?
Well, I attended the Global Ministerial Summit on Patient Safety in Montreux in Switzerland in 2023, and I was moved by a quote from Dr. Tedros, the Director General of WHO, who said, if it's not safe, it's not care. And I think that is so important. Patient safety is not just something nice to have, it's really a moral imperative.
Oh, wow. This conversation has been so inspiring. I am so honored to have you. And by the way, you will have such a good English. For it's not your primary language, just as my case. Congratulations.
Thank you
Because
very much.
sometimes it's good for me as a non-English speaker to understand the accent, and you don't have an accent at all. You have such a good English. Congratulations. So, well, thank you so much, everybody, for joining us today. Dr. Anthony, thank you so much for this insightful conversation, for your time, and for your contribution for patient safety globally. And to our listeners, thank you for being here, and stay tuned for our next episode of Podism. See you soon. Bye.
Isabella Castro, thank you for having me. Bye-bye. Thank you.
Thank you. It's been an honor.